even if I'm healthy right now, I could do a set of things that would give me this.
Yes. In fact, if you take, so back to our conversation about antibiotics, if you take antibiotics, your risk of developing an inflammatory bowel disease in the next year just doubled.
Oh gosh.
If you disrupt the gut with antibiotics, which the antibiotics do, there's nothing that will basically like decimate the gut faster, reducing gut diversity, disrupting the gut barrier by 50% during a course of antibiotics, and activating the immune system. It really speaks to that, like if you take antibiotics, these risks of inflammatory health conditions really start to go up. We see this in both adults and kids.
You had a patient of yours called Michelle who took antibiotics and had a life-threatening swelling of her colon. This is the colon, right? Tell me where the colon is.
So the colon is the large intestine.
And so she took an antibiotic and had a life-threatening swelling of her large intestine.
So she took an antibiotic, she took clindamycin, which is a classic skin antibiotic.
Okay.
And the problem is that clindamycin wipes out your gut, like hard. And when that happens, there's a risk that this pathogenic, like bad bacteria called C. diff, if it's in there, it can multiply, and then you get this infection, the C. diff infection, that causes inflammation of the entire colon. So this patient, Michelle, what happened, I was on call, and I get this text, and they say, you gotta come to this room right now, this patient is sick. And so I was in the middle of typing up a consultation, drop that, run through the hospital, walk into the room. She's clutching her belly and she's moaning and groaning, and she has no clue where she is. She's sweaty, she's pale, her vital signs are completely out of whack. Her heart is racing, she's breathing really fast. And I did a little test, which is that I gently bumped her bed, just like that. And if a person has severe inflammation of their intestines, they will jump if you do that because they have peritonitis, right? Or you could call it an acute abdomen. So just by bumping the bed like that was enough for her to, and she's screaming, right? And clutching her belly, and she has no clue where she is or what is going on. She's completely delirious. She was maxed out on antibiotics. Her choices were to rush her to surgery, remove the colon, or alternatively to give her a fecal transplant and give her a shot at keeping her colon. And so the amazing thing is that number one, that procedure went really well. By the next day, she was a normal human being. She was laying in bed. She was able to have a conversation. And after 2 days, she was so normal that we were able to send her home.